Hi folks, this is Dr. Rob Cywes. I'm the carb addiction doc, and as you know, on this channel we discuss a variety of different topics, and I'll give you my perspective on it. By the way, if you like this topic, if you like what we're putting out here, hit the subscribe button. It helps us, and if you really want to help us, throw a few dollars at our Patreon account, Carb Addiction Doc, or if you look below, there's a link to our PayPal account. But today we're going to look at some cutting-edge thoughts in healthcare, in medicine, particularly relating to type 1 diabetes. But for those of you that don't have type 1 diabetes, listen up, because this extends beyond that. The issue with type 1 diabetes is that the pancreas does not produce insulin. The pancreas does not produce insulin. The cells that produce insulin have been killed. We think by a virus, perhaps an autoimmune reaction. They don't work. So type 1 diabetes, by definition, is a deficiency of insulin to the point that insulin is absent, and all the things that insulin does, not just managing blood sugar, but also all the other hormonal control systems are missing. The anabolic phase, the growth phase of the body is missing. So we have to give artificial insulin by injection. That should be the only difference between a type 1 diabetic and myself. However, type 1 diabetes has been so distorted in terms of how it's managed out there, partly because of history, partly because of intentional ignorance on the part of endocrinologists. Just as an aside, I was sitting with a professor of endocrinology and the director of endocrinology at a large university hospital, and he said, diabetics are different to normal people. They have to be treated differently. They must eat carbohydrates. They have to have higher blood sugars. They have to have higher A1Cs. Absolute bullshit from this person that's supposed to be an icon of diabetes management. I can understand why diabetics, when they discover the truth, are so angry at their endocrinologists. The natural enemy of a type 1 diabetic is their endocrinologist. So, having said that, I was sitting down with the Omnipod reps, which is a form of insulin. I've sat down with the people that produce the tandem insulin pump, because I use these pumps with my type 1 diabetics, and they're great insulin delivery vehicles, but they're so frustrating for me because they start giving extra insulin at a blood sugar of 110 up to 140. 110 is a ridiculously high blood sugar for me. I want my blood sugars for my patients to be in the 80s on average, not at 110 to 140 or 200, because it's causing damage. So the entire thought process of how these pumps are set up, and then they've got all these ridiculous carb calculators that you've got to add these many carbohydrates and do this multiplication mathematics to figure out how much insulin to give yourself and to set the pump up with it. Guys, if I'm struggling with it, I know I'm just a surgeon, I'm not that smart, but if I'm struggling with it and I work in the space, how the hell can we expect ordinary patients who are not maths wizards, I'm certainly not, but not scientists, not biological, not doctors, how the hell can we get those diabetics to set up their own pumps and manage their pumps effectively with safe blood sugar ranges if even I can't do the math to support these pumps? It is crazy, it's ludicrous. And when you talk to they defend that. They don't say, oh, you know what, maybe we're wrong, maybe we can help you to change this, maybe we can make it simpler for our patients. So what do the patients do? They don't use the pumps. They don't use the pumps. My healthiest diabetics cannot use the pumps because they're out of range and out of date. Now, that's a separate story, but there are ways to manage this and to lie to the pumps so it gives you adequate insulin. Having said which, because of this whole carbohydrate, you must eat carbohydrates, you must do this, and most patients are told to eat carbohydrates to manage their insulin. Seriously? You're told to eat carbohydrates to help you to handle the amount of insulin you're injecting. Well, if you don't eat the carbohydrates, you don't need that much insulin. Anyway, the point is that every type 1 diabetic who's eating carbohydrates, by definition, develops insulin resistance. Because of their carbohydrate consumption, their cells have to defend themselves, so they become resistant to their own insulin they're injecting. Then they have to go up on the dose of insulin to normalize their blood sugar, which is crazy, because what they do then is they gain weight. So we've got overweight, unhealthy, insulin-resistant people because of the dysfunctional way in which endocrinologists manage type 1 diabetes. Absolutely screwed up. Now, if you are that type 1 diabetic, and this is where I'm coming to, so long work up to this. The problem with most type 1 diabetics, the thing that's going to kill you is your insulin resistance. And you could go on a carnivore diet and get rid of that insulin resistance slowly over time. However, it's very difficult to do. And if you've already got some eyesight, some vision problems, some retinopathy, some gastropathy, some peripheral neuropathy, some kidney changes, you're in trouble. And the faster you can reverse the insulin resistance, the better. The ideal way to do it is to begin with a ketogenic or a low carbohydrate diet. It is not necessary to eat carbohydrates. And as you do that, as you become insulin sensitive, you'll find your insulin requirement goes down and your stabilization of your blood sugars goes up, and you become more fat adapted. So you're able to use fatty acids rather than sugar as a fuel source. However, that's difficult to do. That's difficult to do if you've been doing it this way for 30 years. There is a wonderful, and I'm not a medication guy, folks, but there is a wonderful, wonderful medication available to treat insulin resistance. Now, the quintessential person with insulin resistance is your average type 2 diabetic who's eating a ton of carbohydrates, they're addicted to carbohydrates, and they develop insulin resistance because of the amount of carbohydrate they eat. So this medication was originally developed to treat type 2 diabetes, but pretty much every type 1 diabetic also has insulin resistance. And here's the thought process. Even though you do not produce insulin, this medication is still incredibly effective at helping you to lose weight and to block the release of glucagon and the release, therefore, of sugar from your liver in the face of an elevated blood sugar. So it helps you to control your appetite and it helps you to control glucagon. It doesn't necessarily have the effect, the third effect, which is raising insulin because your cells can't produce it. But that's GLP-1 agonists. Your MOUNJARO, your OZEMPIC, your TRULICITY, your Rybelsus, there's a whole bunch of them on the market, and I like the once-a-week dosage ones. Those are the more modern ones where you're injecting it once a week. GLP-1 agonists are wonderful, wonderful drugs for type 1 diabetics to treat the type 2 component, which is their insulin resistance. The endocrinologist will say, oh, that's contraindicated. You don't produce insulin. You're an insulin-dependent type 1 diabetic. Bullshit. Bullshit, 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 bullshit. Did I say bullshit? The GLP-1 agonists will help you to control the type 2 component, help you to normalize and flatten out your insulin utilization, avoid the high spikes. It is a very powerful, powerful, beneficial drug. It will not cause hypoglycemia. It will not cause hypoglycemia, which is the biggest threat that endocrinologists threaten you with, and therefore they run you high. Get rid of the carbohydrates, go ketogenic, but use the GLP-1 agonist as a type 1 diabetic to help you to normalize your insulin resistance and become sensitive to the insulin you're injecting. Boom, aha moment, aha moment. And if your endocrinologist tells you it's a bad thing or a terrible thing, set up a consult with us. Text me at 561-517-0642 because your life depends on your correction of insulin resistance. The primary reason that type 1 diabetics die is not because of type 1 diabetes. It's because of type 2. It's because of type 2. It's because of hyperglycemia and insulin resistance. And this medication, together with our eating plan, will help you tremendously to stabilize your diabetes. Give us a shout if you want to explore it. I'm happy to prescribe this, but I've got to get to know you as a patient first and make sure that all the other boxes are checked. But the GLP-1 agonists are wonderful, and it's going to be a decade or two before the world accepts the fact that it can be used for type 1 diabetes. How many bad things are going to happen to you during that time? I am the Carb Addiction Doc. I am Dr. Robert Cywes. I am proud of the fact that I've stolen this idea from a type 1 diabetic who is on a GLP-1, good buddy of mine. I work with him as a colleague, and he brought this idea to me, and it just exploded my mind. I can't use his name because professionally I don't want to put it out there, but this person has stabilized his insulin resistance and is doing amazingly well. Give me a shout, but think it through. Leave comments, leave questions, and if you like what I just said, hit that subscribe button, leave a comment. I will answer the comments, and also if you want to, throw a couple of dollars at our Patreon account or our PayPal account. It's to pay for James behind the camera. I don't benefit from it. See you next time.